Hello, everyone, and thank you for joining us today for another episode of Conversations in the Community. My name is Dania Parker-Smith. I am your host. I'm a realtor with the agency Real Estate Brokerage here in London, as well as the sponsor ambassador for the parkbench.com websites for South London and Wortley. Today, we're just going to be speaking here with Jordan Wall. He's a local dentist in the Wortley area, and Jordan and his team have been working very hard through all of the lockdown and trying to prepare for what is going to come. So I just wanted to welcome Jordan here today.
Thanks, Dania. It's nice to be here.
Great. So Jordan, just tell us a little bit about yourself, where you grew up, and how you landed in Wortley Village.
Yeah, you know what? Summarizing 21 years, I'll try and do it as fast as I can. I was born in Winnipeg, and my family quickly went back to Kitchener, where I grew up. And since I've been away from Kitchener since I was about 18. I went to school in Michigan and then came back and went and did my dentistry at Western Ontario here in London. So I landed up in Wortley, just skipping a few years there. After I graduated dental school, I went and had a practice in Cambridge and then found Dr. Dial here at 250 Wortley Road, Wortley Road Dental. And yeah, you know what? It was worth the wait to land at a really good spot, and couldn't have asked for a better location to be practicing.
Amazing. That's great. I love to hear how people got where they're at. So what made you want to become a dentist, and how old were you when you knew that was part of your path?
So dentistry was never on my radar when I went to university. I just was not a great student in high school, so I just never thought it could happen. When I went to Michigan, I had known my wife in high school, but then her family moved to Florida, and then we both went to school in Michigan. She says I chased her, but I joked that it was the other way around. And anyways, but you know what? I took some classes with her, didn't want to be looked at as a slacker, so I applied myself, and then, you know, got started into some sciences. But she had a need for a root canal treatment when we were there, and we were international students.
Oh.
And yeah, the dentist did it for her for free. And it was really impactful for me because I really wanted to do something that I felt had value, that I felt was meaningful. And that really spoke to me. And I thought I'd like to try to do that for somebody else one day. And kind of went from there. I'd say Karen, my wife, believed in me when I didn't in myself, and that kind of really, she said, "Oh, I think you could do this," you know, and that's kind of how it began.
How long has Wortley Road Dental been operating, and how long have you been a part of it then?
Okay, so Karen and I have been here 6 years, and Wortley Road Dental as a practice has been around for over 60 years. So before we were at our current location, they were at on Central Avenue. And they moved to this current location about 35 years ago. It's a well-ingrained practice in the community, and take care of, you know, grandparents and parents and children, grandchildren, great-grandchildren. So
how many people are on the Wortley Road Dental team?
We have 11 team members at this point. There's, of course, me and Dr. Dale as the dentists, and then we have 3 hygienists. We have 2 reception, two assistants, and then Karen is our director. Yeah.
Right. And it's general dentistry that you guys practice.
Yeah. So the nice thing about one of the things I really like about being a general dentist is that you can seek out training in many different areas. So the nice thing is that even before I got here, Dr. Dial did some traditional orthodontics. So I got some training in that just to make sure that he's a long way from retiring, but that I could take that over when he went to go. So we do traditional braces, we do Invisalign, I do dental implants, and we do gum grafting. We do, so lots and lots of stuff. Root canals, rehabilitations for people's teeth if they've really ground them down. So we try and do as much as we can here, because patients, I find, like the comfort of staying in one place, if they can, you know. Everything we're trained well on, and we only take on what we're able to do in the best interest of a person. We do work with other specialists, but we do a majority of what we can do here in the building. Yeah.
What are you guys doing to prepare when you're allowed to reopen and provide services again?
Yeah, Dania. So obviously, it's affected everybody in a huge way. What we've been doing for the past, well, the timeline is this, right? The health unit, or the Ministry of Health shut down dentistry or services like dentistry. But of course, we have to be available in order to provide emergent care for people to try to keep them out of the hospitals, right?
Right.
So that's what we've been doing for the past, 10, 11 weeks is remaining open. Karen and I come 9 to 12 on a weekday basis, and we're answering phones, doing video chats like this. So I'm very, very used to Zoom because of that. And you know what, we're trying to help people with, of course, the bias towards not making them have to come in. But in the case that they're resistant to antibiotics, their condition, or the counter medications, then we have a screening protocol before we bring them in. And then, some people do have to come in. And in that case, there we have measures to make sure that things are safe for them, for us, and for whoever may come afterwards, right?
Right.
So, and then getting ready, right? The last part of your question, like, what's it going to look like after this? So I want to say that I'm really impressed with the guidelines that have been laid out already. So where it's at right now is that the Ministry of Health is just reviewing the guidelines that our governing body, the College of Dental Surgeons of Ontario, has laid out, particularly around aerosol generating procedures like the drill and this kind of thing, right?
Yeah.
And so that being said, what we do have, what it's going to be like is there's going to be pre-screening before a person comes in. Everybody who enters the building is going to have to wear a mask. They're going to come anytime there's a aerosol generating procedure. That's this kind of stuff. These regulations may change at this point, but rooms are going to be enclosed. At this point, we're being recommended to have a certain air filtration rate with HEPA filters to capture the aerosols. It's just, honestly, I want a person, though, to be able to walk into our building, and even though there are all these physical differences, to still feel the warmth of care. And you know what I mean? That it feels, that it feels, number one, safe, it feels easy, and they don't feel the burden of anything extra that we might have to do to take care of them, right?
How can people find you and reach out to you guys to book appointments and find out questions about their dental concerns?
Yeah, you know what? You can call us. Our phone number, of course, is 519-672-4310. Our website is www.wortleyroaddental.com. And of course, we are on Facebook, we are on Instagram, and we can find us all these places.
That's great. Well, so your wife is everywhere promoting your business. She does a great job too. Like she always makes you guys look great. I love the little memes that are like, nobody likes bugs in their mouth.
You know what? One of the most effective ones. It's true. No one does like
for
bugs.
Kids. I think that's really important, right? Like that's ooh. Anyways, Jordan, it's been a pleasure having you here with me today. I just want to thank you for joining me. And any of you, if you do have a business that you would like to have promoted on the parkbench.com websites, please give me a call or a message. I'm happy to have you here. Thank you so much for joining us today.
All right. Thanks, Dania.